Good morning, everyone. And I mean, this is a great morning for Pennsylvania. I can't tell you how. I cannot tell you how excited I am to introduce House Bill 1900, the ABA for All. This bill we've been working on for a couple years, and it has finally come to fruition. This is also known as better access to treatment. ABA is Applied Behavior Analysts, and we are so proud to have so many helping us today sponsor this bill. So let's give everybody a round of applause for all your help. With all the hard work over the last couple months, we've got over 102 co-sponsors, and everybody knows if we have 102, we can pass a bill. ABA was brought to me by friends, and most of them are speaking here today, and my good friend, Representative Tom Mert. We sat down together in the district at the Vista School for Autism, and we were so privileged to sit there and talk about what we can do to help more people, how we can help people across this state, and how we can fight the opioid epidemic, help those with intellectual disabilities, help those with PTSD, help out with the suicide problem that we're having here in PA and prevention of suicide, and all of the things that go together that these fine folks have done in 30 other states where they're licensed. And today is the day that I reach out to my colleagues and I reach out to this General Assembly and say, please pass HB 1900. It is so important that we get this done for everybody who needs this help throughout Pennsylvania. And I can't tell you, when I sat down with these folks and talked about this, my heart goes out to those in the autism community and all the things that have done. Back in 2008, we passed our Act 62, and it was so important. But this is the next step, folks. This is where we need to be. This is what we need to do. And this is not just about autism, but it's about all the things I mentioned earlier. And this is where we need to go as Pennsylvanians to make sure that those that need treatment can get the proper treatment needed. We have so many great speakers today, and I'm not going to take a lot of time, but I do want to introduce the man who helped co-introduce this bill with me, Representative Tom Mert. Thank you.
Good morning, everyone. Welcome to the Capitol. It's great to be here to talk about such an important topic. In the House of Representatives, Representative Tom Mehaffie and I have dedicated ourselves to finding better ways to help our brothers and sisters who struggle with an autism spectrum disorder or special needs. We want them to live more fulfilling lives. But we can't do this without the input and the active contributions of behavior analysts throughout our Commonwealth. These mental health professionals treat individuals with autism and developmental disabilities, as well as provide behavioral coaching and behavioral psychotherapy. Let me be clear. Applied behavioral analysis is widely recognized as the most effective treatment for children with an autism spectrum disorder, and the only treatment shown to lead to significant, lasting improvements in the lives of individuals with autism. ABA works, and professionals who are qualified to use ABA are using evidence-based and cutting-edge therapies to help those with behavioral challenges find success, fulfillment, and an effective level of integration. It's long overdue for Pennsylvania to recognize behavior analysts who are board certified in a way that protects the public, recognizes their expertise, and affords Pennsylvanians with an autism spectrum disorder the finest treatments available. In our current state, there are shortages of qualified providers, and there are individuals who claim to be using behavior analysis when in fact they are not certified to do so. This is causing a lack of treatment efficacy, which harms our most vulnerable citizens. Without a license, these talented, well-educated ABA providers cannot work with insurance to treat our loved ones like they're able to do in 30 other states. that have licensure laws for ABA. When implemented correctly by qualified and experienced providers, behavior analysis reduces healthcare costs, including reduced expenditures to private insurance, Medicaid, and Medicare. Furthermore, we know that by licensing behavior analysts, we create thousands of jobs in our Commonwealth at a time when Pennsylvania is exporting our most talented, our brightest graduates who are educated in universities but seek employment in the other 30 states where the profession is licensed. We need to do the right thing and keep these talented professionals right here in our Commonwealth, helping our constituents gain access to life-changing treatment so they can have a better life. Before I conclude, two of the most passionate advocates for ABA in the entire Commonwealth of Pennsylvania are my colleague and my friend, Representative Tom Mehaffie, and my good friend, Dr. Cheryl Tierney. And I want to thank them for the great work that they have done. 102 co-sponsors. That's over half the House of Representatives. That's how many men and women in the House of Representatives think that this is a good idea. Thank you very much for your advocacy, and we're going to get this done.
We have many, many colleagues here to our left and to my left and to the right. And I just want to thank them for what they've done and the advocacy that they've pushed forward and came and talked to me and our group and said, hey, this is a wonderful thing, this is a wonderful thing. And that added means a lot to me, Tom, and all of us here today. So thank you, colleagues, for coming out, and thank you for signing on to this bill. It is my pleasure to introduce our leader in ABA, Dr. Cheryl Tierney.
Good morning. Can everybody hear? Yeah? So my name is Dr. Cheryl Tierney Avis, and I'm a developmental pediatrician at Penn State, and I'm also the president of the ABA and PA initiative. I'd like to take a moment to thank a few important people. No one gets to be up here in a moment like this without a team behind them. I first want to thank Representative Tom Mehaffie for being the champion for this piece of legislation. And next, of course, I'd like to thank Representative Tom Mert, who introduced me to Tom Mehaffie, and in doing so made today possible. While there are too many individuals to name individually, I'd like to thank my leadership team at ABA and PA, most of whom are standing with us today. And finally, I'd like to thank the sponsors for today's event, the employees and families of Potential Inc. and the Springtime School in Bucks County, everyone at Achieving True Self, Norabilities in Philadelphia, everyone at ABA Support Services, and of course, in my hometown, Behavior Therapy International. So thank you all for your very generous donations so that we could plan today's event and have it be so successful. So why are we here today? We are here because as it stands, behavior analysts are simply not recognized as an independent profession, and as they are in 30 other states. We have licenses for contractors, electricians, and plumbers, but we do not have a license requirement for behavior analysts who practice applied behavior analysis. Nationally, ABA is the fastest growing profession helping profession in the country, and Pennsylvania is lagging behind and recycling the same old models using new names without any proof of its effectiveness. let me be clear. We need this legislation. Not only is it time for Pennsylvanians to have access to the expertise and services provided by behavior analysts, but Pennsylvania is falling behind the national trend to license this profession. The impact to those in need of behavior analytic services is too great. Pennsylvania residents deserve the effective, scientifically supported, and compassionate programming from qualified professionals. Applied Behavior Analysis, or ABA, is the science of behavior that allows us to understand and change socially impactful behavior. And when practiced correctly, works and is life-changing. But don't take my word for it. Let me introduce you to some people who are going to show you how.
Thank you, Dr. Tierney. My name is Kirsten Urich, and I'm the CEO of Vista Autism Services. For about 2 decades, Vista has been innovating autism care, advancing the status quo of applied behavior analysis across Pennsylvania, and providing hope to people living with autism. I'm also a behavior analyst. Although the focus of today is a celebration, we would be remiss if we did not put into context the significant need for this legislation. ABA for All is about freedom. The freedom to reach one's fullest potential in spite of the unique challenges of an autism spectrum diagnosis. I have witnessed firsthand the way in which qualified behavior analysts unleash the untapped potential of those with significant forms of autism, altering their life trajectory from one of isolation and institutionalization to one of self-expression and gainful, productive employment, from dependency on the community to becoming one of the pillars supporting it. In my work at the Vista School, I have been blessed to watch our children grow, mature, and eventually thrive, becoming who they were meant to be because of the timely intervention of quality treatment teams that gave them the tools to overcome their challenges. Nothing says success about the work that we do than giving these children the freedom to live their lives to the fullest. And today, I want to share a story that illustrates that transformative, liberating change. And yes, it is a story about freedom. This is Matthew. From late infancy through his early childhood, the symptoms of autism had such a tight grip on Matthew that it limited his freedom in the truest sense of the word. He couldn't communicate. He would act out in ways that would injure himself and others, sometimes significantly. His parents, like so many others with children of severe autism, were told that he would not have much of a future. And in most cases, that would be the final word. End of story. Most parents would lower their expectations when given that verdict. But that was before ABA. Despite dire predictions about his future, Matthew's parents believed in a grander vision and sought out ABA at the Vista School. Over time, ABA gave him the freedom to express himself. It gave Matthew the freedom to master new skills, which in turn gave him the freedom and power to overcome anger, frustration, and disappointment, and the aggressive behaviors that often accompany the isolating symptoms of significant forms of autism. Like so many of us, today Matthew has hope and purpose, and because he is free to chase his dreams. Matthew works 2 jobs. Matthew has friends and hobbies. He is living a full life of purpose, doing many of the things that you or I would take for granted, but before ABA would have been beyond his reach. Matthew is available after the conference for interviews, right?
Yes.
Yes. But the full story doesn't end there. Quality early behavior intervention results in tremendous cost savings. Between $750,000 and $1.3 million per person across the lifespan is saved when a child receives quality services. In 2011, there were just over 4,000 children in Pennsylvania under the age of 5 receiving autism services through private insurance, Medicaid, or early education programs. With a lifetime savings average of just over $1 million per child, this equates to a future savings of $4.3 billion in Pennsylvania healthcare education systems alone. For those who need it, ABA also means freeing up resources of our increasingly overburdened juvenile justice system. Children with autism who don't receive early intervention services are more likely as adolescents to find themselves being processed by our courts as a result of problem behaviors. According to the Pennsylvania Autism Census, there are more than twice as many children with autism going through our juvenile courts than there were 6 years ago. Without intervention, this number is close to 5,000 in 10 years. Autism is not a crime, and to funnel these children through our criminal justice system is a tragedy, and not to mention a senseless waste of limited resources and taxpayer dollars. Less than 16% of adults with autism in Pennsylvania are working in competitive employment. The state wants that number to be 30% in 2022. ABA offers a proven solution to that problem. At Vista, we already achieve over 50% employment for our clients using an ABA-based approach. Employment programs like ours that integrate behavior analysis to teach individuals to navigate the behavioral and social complexities of this world make it easier to land and keep a job, which in turn makes it easier for our community employers to accept applicants who have autism. Remember Matthew, who has 2 jobs. He is just one example of the successful integration of ABA and employment training. ABA also plays a crucial role in our national healthcare system. Without integrating ABA into our Pennsylvania healthcare system, and more importantly, without defining the minimum standards of who can be licensed to practice ABA in Pennsylvania, we are in danger of being left behind and wasting money. Other states, such as Arkansas, are more advanced and have learned that when you mandate the inclusion of a behavioral professional to be involved with complex medical care cases, you save money and improve health outcomes. The positive power of ABA for individual behavior change is unmatched. In a time where the impact of one individual can be profound, for good or for great harm, the time for ABA is now. Thank you.
Thank you, Kirsten. This is an exciting day. Great to see so many people out. My name is Dr. Jonathan Ivey. I am an assistant professor of psychology and the professor in charge of the Applied Behavior Analysis program at the Pennsylvania State University, Harrisburg. In addition to research in teaching and behavior analysis, I have also served in a clinical role for over 15 years, primarily in the area of assessment and treatment of aggressive and dangerous behavior. HB 1900 is about your freedom to pursue treatments that reduce violent behavior without sacrificing civil rights. This bill also provides the hope that we need to create a world with less violence and less aggression. Hope that we can reduce the externalized aggression that leads to tragic mass shootings. Hope that we can reduce the internalized aggression that leads to self-harm, addiction, and suicide. Hope that one day we will be free from the fear that a loved one could be the victim or perpetrator of a violent act because evidence-based treatments were not available. Since the inception of behavior analysis, practitioners have worked with families, individuals, as well as members of the community impacted by aggressive or violent behavior. This is part of our history. Problems like violence are born of behavior. Behavior analysts take a unique and specialized approach to solving these problems, beginning with a simple premise. Problem behaviors have a purpose, a cause, a reason, a why. Using behavior analysis to find the purpose of these behaviors, the why, places the treatment team in the best position to develop informed and evidence-based solutions. Knowing why allows doctors, psychologists, social workers, other mental health and physical health practitioners, as well as those individuals directly affected, learn better ways of interacting with the world. Imagine a world with less violence. Imagine fewer mass shootings, fewer tragic suicides, sexual assaults, or petty street crimes. Behavior analysis has a critical role in developing effective, long-term, individually tailored solutions to these and many other problems that plague our modern lives. One of the founders of behavior analysis, who was a Pennsylvania native no less, once wrote, "In trying to solve the terrifying problems that face us in the world today, we naturally turn to the things we do best. In the end, the passage of this bill will allow behavior analysts to do the things we do best, better serve those impacted by violence, to balance the protection to the community and protection of individual liberties and dignity. Further, this bill will ensure basic minimum standards for licensure so that all Pennsylvanians will be free to access quality behavior analytics services." Thank you.
My name is Amy Gable. I am a behavior analyst and certified teacher. I own and operate ABA Support Services, an agency that has served hundreds of Pennsylvania children with social and behavioral challenges. I'm pleased to speak on behalf of vulnerable populations that cannot speak for themselves, and I am here representing two of them who will benefit from House Bill 1900: seniors and veterans. I would like to recognize Christabel Smith, a certified activity director who is here representing the field of activity professionals who cares for seniors in desperate need of the skills ABA can bring to senior care. Quality of life for seniors depends on the expertise and training of the activity professional caring for them and are often placed in difficult and challenging positions. These caregivers treat patients with wide-ranging diagnosis from brain injury to autism, Alzheimer's to addiction. Many present with behavioral challenges, and too often the elderly are prescribed drugs as a quick fix. Drug-based treatments come with unintended consequences. Psychotropic drugs are not recommended for treating the elderly. They have been proven ineffective for treating dementia, and in fact, studies show their use actually leads to early deaths among dementia patients. There are 5.4 million Americans diagnosed with dementia. This number will more than double in 10 years. While it is the vision of many facilities to reduce medication, they need access to non-drug alternatives. The freedom to access high-quality ABA is the answer. Dr. Jonathan Baker is an expert in behavior analysis in senior settings. His work has demonstrated that using ABA in elder care is effective at reducing problematic behavior and is significantly cost-effective. As demonstrated by a study funded by the Illinois Department of Aging, one year of ABA-based care for an individual at home costs the same as 1 month in a nursing home. Before I introduce my other friend, I want to take a moment to say that I descend from a proud line of honored military families who have served their country and wore the uniform to defend American freedom, going back more than a century, many of whom now rest in Arlington Cemetery. Before the Second World War, President Franklin D. Roosevelt made his famous Four Freedoms speech in his January 1941 State of the Union address, one of which is the freedom from fear, which I believe extends to all of us today, but even more so, for our combat veterans. Freedom from the fear of reliving the nightmare of war over and over after they leave the battlefield and fight to re-enter a normal civilian life. To my left is a dear, dear friend, retired Technical Sergeant Joshua Gleason. He is an Air Force veteran who completed 4 tours over 13 years of active duty service, and he embodies the military virtues of strength, courage, honor, and sacrifice. I would like to ask everyone to take a moment to honor the strength and courage it takes for him to be here with us today, representing those soldiers who could not be here and prefer not to be named, but we already have done that. Statistics show that many of our veterans have difficulty enduring the trauma they have faced to defend our freedom. The trauma does not stop after the time they serve. And as we learned from Vietnam, the war is never really over. Similar sights, sounds, or smells within their environment can vividly and immediately return them to the original trauma. The soldier may have panic attacks, nightmares, insomnia, and chronic anxiety. Soldiers may often avoid situations that can trigger these emotional responses, which prevents them from ever truly coming home. The soldier who witnessed a van explode may avoid all vans after they return. The sound of fireworks on the 4th of July can trigger traumatic memories of mortar shelling or an IED explosion, to say nothing of the smell of gunpowder. Even getting into a car or truck can trigger severe panic. And these combat associations cannot simply be pushed aside. These associations can cause paralyzing fear and may limit employment opportunities, quality of relationships with their children, intimacy with their partners, ultimately leading to depression. Of the 8.2 million Vietnam veterans, or the 2.3 million soldiers from the Iraq and Afghanistan war, 20% are reported to have PTSD in comparison to 4 to 6% in the general population. More significantly, almost 50% of PTSD cases go unreported because of the stigma associated with it. Too many soldiers that need these services are not getting them. ABA therapies can bring many of them closer to home. ABA teaches PTSD clients to engage in active behaviors to accomplish their goals. ABA targets the client's avoidance behaviors through the implementation of specific activities or replacement behaviors. When those that suffer from PTSD pull away or avoid situations they used to find enjoyable or meaningful, the avoidance makes PTSD worse and often leads to depression. Evidence shows that ABA helps those with PTSD become more engaged in their former lives again, and they can identify the things that are stopping them from living a life of freedom from fear. When the stakes are this high, it is our duty to protect those who have protected us, by saying clearly that if the citizens of Pennsylvania want to honor our veterans, then we need you to support House Bill 1900, because it offers our veterans the freedom to find quality ABA practitioners ready to serve them. Thank you.
So so I get to end. Before making Pennsylvania my home, I practiced medicine in Massachusetts for about 10 years, and I saw firsthand the outcomes of ABA for children with autism and other disabilities that we in Pennsylvania should be able to achieve, but we do not. I know I am not alone. I have a son with autism, as well as other mental health and behavioral challenges. We lived in Massachusetts during his formative years, and he accessed quality ABA. I fought for him to receive it here, and luckily, he did. He is also going to graduate high school and attend college next year. Not without struggles, but he would be the first to tell you that his treatment, and by that I mean ABA, helped him get where he is today. I have close family members and friends who struggled with the chains of addiction. While they are able to get treatment, once an addict returns to home to the same environment that led to their addictive lifestyle, the same friends and social stressors, the chances of relapse are very high. A licensed behavior analyst as part of that treatment team is meant for just that purpose, to help change the environment so that your loved one's chances of relapse are less. A year ago, I attended a funeral for my partner's son. He was in his 30s. He was addicted to heroin, but he was back in school and he was doing well. However, like many recovering addicts, he began to feel at risk. And 2 weeks before he overdosed, he went to an emergency room and asked to be admitted, but he was turned away. We know his story could have had a better ending if a behavior analyst was part of his treatment team. Instead of a path to vulnerability, ABA offers a path to resilience. Instead of a path to dependency, ABA offers independence. Instead of minimizing those with differences, we offer a new way that preserves one's dignity. ABA for all means delivering the promise of opportunity, self-reliance, and personal achievement for those who have been unable to reach their potential so far. Clearing the path from the many obstacles that are standing in their way of living your life to the fullest. That is the definition of freedom. Thank you.
I think everybody can tell how passionate we are. This advocacy won't stop. It'll continue to go on, and we are going to be here till we see this across the finish line. I want to thank everybody today for coming out. Thank you so much. Again, this doesn't happen without you. This doesn't happen without your advocacy. And as you can tell, young men like Matthew here have done such a great job, and what ABA did for him was excellent. So myself and the other speakers will be glad to answer any questions afterwards. This concludes our day in the Hill with ABA, and we want to say thank you to everybody that participated and helped out with this to make it a success today. Thank you.